Good morning, everyone, and welcome to Weekly Wake Up. This is a Boulder Valley School District's chance to really connect with our employees on a weekly basis, and we're glad that you're joining us this morning. This morning, we've got a great group of people to talk about sort of the next steps that we'll be taking in our reintroduction plan. First of all, I hope that everyone had a great weekend. It was certainly beautiful out there, gorgeous weekend, and I want everybody to remember that we've only got 2 weeks until spring break, that much-needed break and rest that we all need to recharge. It also means that the big day is approaching for our secondary schools to move to phase 4 in-person learning, where students will be attending for 4 days a week. I know, like much of the previous transitions that we've had, some in our community and schools are eagerly awaiting the change, while others might feel some consternation. And so, as always, we're here to answer some of your questions. In fact, I do want to give out a shout out to our members of that were part of the Phase 2 Working Advisory Group back in the fall. They were the ones that actually recommended doing a show kind of like this. To help answer people's questions. And so I just want to give a shout out to the teachers and to the principals and the employees that participated in that, as well as I think DAC and a few other parent groups. Such important feedback. It's also the reason why we're doing that big PBL project that we talked about last week. And if you didn't get a chance to tune in, you'll definitely want to queue that one up. It was really interesting hearing from the teachers that have been participating in that big PBL perspectives project that's giving students a chance to really share some of their learning and their understanding from this last year. But I do want to get into the work that we've got at hand today. And I do want to remind everybody that we are, as always, taking questions from you. The way that you send those in is through bit.ly. That's bit.ly/BVSD Wake Up. Again, bit.ly/BVSD Wake Up. And with nothing further to do, I'm going to go ahead and introduce our awesome panel of folks this morning. Let me start with the Honorable Dr. Urbina. Good morning, Doctor. How are you? Oh, I don't hear you still.
I said good morning. Thanks for allowing me to be here.
Thanks. Thank you, Chris. Thanks for joining us. We've got Jackie from Boulder Community Health. Good morning, Jackie.
Good morning, everybody.
How are you doing today?
I am doing well, thank you. Hope everybody is as well.
Absolutely. Rob Price, Assistant Superintendent of Operational Services. Good morning, Rob.
Good morning, everyone.
Margaret Crespo, our Area Superintendent of the amazing Southwest Network.
Good morning, everyone. Thank you.
Good morning. Stephanie Farron, our Health Services Director.
Good morning.
Good morning, Stephanie. And finally, and not last, definitely least but not last, I don't know, I didn't say that right, Mike. Mike Karadas, Assistant Superintendent of Human Resources. Good morning, Mike.
Hey, good morning, everybody.
All right, so please go ahead and send in those questions as we go. But I do want to start off with vaccinations, which have been going really, really well. Jackie, once again, I want to really thank your team for the hard work that they put in. It has been amazing to go to these clinics. I took part in the third and final one. I think Dr. Anderson, our superintendent, was in the very final slot on that third weekend when we were giving out the first shots. And I think everyone's perception of it is that it went rather smoothly. I know that with a large event like that, there are always a few hiccups, but we just really want to thank you and your staff for everything that happened over the weekends that have happened and the weekends that are ahead. Thank you.
Oh, well, you're welcome. And yes, the team is great. They've done a great job, and I appreciate the feedback, and I'll let them know.
I think that we had something like 1,000 employees a weekend going through. What was that like to see all these teachers and educators coming through the center over there?
Well, it was pretty exciting. I was also there on one of the Saturdays as well. And I can't tell you how, as we talked about maybe last time as well, this little clinic has turned into kind of the happiest place on earth. So we say we can beat Walt Disney World now because it is such a great feeling to be able to help people be protected from this pandemic. So I will tell you, we have very little trouble getting people to volunteer to come in and work at the vaccine clinic, especially for the teachers. Everybody was really excited to be able to help protect our teachers.
Well, there's no doubt that Disney could certainly learn a little something about line management. we're not hour-long lines. It was super quick to get through there. So amazing job in that. And I do want to mention that, to your point about it being the happiest place on earth, it's been fun, this last weekend. I still saw social media posts of folks that were, excited to get their second shot. And so that process has begun. How's that working out?
It's going very well. And I hope those that went through last weekend found that it was even faster getting through, because we have all of that quote unquote paperwork, which isn't in paper anymore, but all of that done so that you can move right through. So it went really well. Again, we're so excited to have the teachers vaccinated.
I know that at least when I went through, part of the process was actually making that second appointment. I can't imagine that anybody escaped the room without doing that. But hypothetically, if they did miss out on scheduling their second appointment, or maybe for whatever reasons they have to adjust that plan coming forward, how do they go about that? Do they give you guys a call on that line?
Yes. So there's two ways you can do that. One is if you want to reschedule, or if you don't have an appointment, you can go through the My BCH chart app, and you can do it that way. If you don't have one yet set up, you can still do that. So you can still go ahead and set that up. And our technology issues that we were having with that, to automatically set up a chart for you with some identifiers, is now back on again. So it should be much easier again to set up that My BCH account. Or you can call the call center, which I believe you all have that number. We certainly prefer that you stick to the Saturdays. I know that there is an issue with spring break for some for that third weekend. And so there has been, I think they've already scheduled some on that Friday before, or a different day of the week. We would hope that anybody that possibly could take the Saturday, just because we're trying to keep the appointments during the week for our elderly, and trying to really get through all of our elderly people and get them vaccinated and get them their second shots. And so the more teachers that move off a Saturday, the fewer appointments we have for the elderly, because we're not doing the reverse. So we're keeping the Saturdays for our teachers.
I know that there are some employees, for various reasons, that have not gotten their shots yet, because I know that we've heard, obviously we've got pregnant, employees, we've got folks that are maybe dealing with an illness or whatever. It was not the right time to get that shot. I know that you're going to be working with us moving forward to kind of help ensure that those employees get through as well. So what's the message that you'd say to them? Don't worry, we'll get you through.
Yes. And so again, all you have to do again is either use the call center or use the My BCH app, set up that first appointment when you are ready. The only thing that you need to do is bring in your badge and your attestation letter to the appointment, so that everybody doesn't question you because you're not of the right age or you don't have the right criteria. So again, if you're going to come in on a non-Saturday, that's what the process would be. And yes, we will take care of you. Again, if you're running into any issues, please work with Stephanie, and Stephanie can work with our team and get that taken care of.
Perfect. I also do want to just mention that you are the Vice President of Operations and Chief Nursing Officer for BCH. You obviously and your team are working on vaccinating far more than just educators. How does that, just give us the general overview of all the work that you guys are doing right now, in addition to running a hospital and, and all the normal stuff?
Sure. So we actually just started just a little bit of actually doing the 60-plus-year-olds on Friday, as they were the next group, along with the individuals with 2 comorbidities, are also eligible to schedule. We're still working really hard on, there's a few 70-year-olds and above, certainly 65 and above is most of this week and next week, getting their second shots or getting their first shots. So it has been a ride, as you all know, this last year for healthcare, and this clinic is just been a shining example of what our team and BCH can do when we all work together with our community partners as well, and really make it rock and roll for our vaccinations. And this is of course, really near and dear to our hearts, especially the nursing staff and the physicians and those on the front lines, because it means our hospitals won't be full of COVID. So the more we can vaccinate, the faster we can get ourselves out of this pandemic, but also keep our hospitals free from bed after bed of somebody who's very sick. And of course, we continue to see people die from COVID. So we just had another death last week at BCH, and so it isn't done yet. So whatever we can do, I think that is why this clinic is so great. Is that it is freeing up our people to be able to help in a different way, to be able to help prevent the disease versus just caring for the disease.
Yeah, I love, I appreciate the fact that you mentioned, in regards to that we're still dealing with it, but also just that impact that it's had. Watching the media coverage, it is amazing that already, we are seeing sort of these impacts in regards to, cases and certainly hospitalization. So I think that's just a huge, exciting thing that really means that the more normalization, hopefully in the future. I do want to just say again, thank you for your partnership. We couldn't have asked for a better partner in this. Is there anything that I didn't cover that you want to say?
No, I don't think so. Again, thanks for all you do. We are so excited that you're going to be able to go back to the classrooms in a safer manner. And so again, thanks for all you do for our kids in the community.
Well, Jackie, I promised you that you could take off if you wanted to. So I hope that you have a great week. I know you got a lot going on. So have a great day.
Thank you. Thanks again for your partnership. Bye.
Perfect. And I think that's a good segue to sort of kind of our next topic, which is related to that, which is really that we are tracking out in the community, Dr. Urbina, all the vaccinations that are going on here. How are things looking, sort of across our two public health agencies?
Great question, Randy. And I think the challenge for us is not that we don't have available providers. We have excellent providers like BCH, all our community clinics, many of the pharmacies, all our health systems are all involved. It really is the availability of vaccine. And so as we get more vaccine, whether or not it's Moderna, Pfizer, and now the new Johnson & Johnson vaccine, we're going to push it out. There's no holding back. As you know, the new phases have been opened up. Our representative from BCH talked about this morning. Now there are over 1 million people in that category. Phase B in the state of Colorado. So I don't think we have 1 million vaccines yet ready, but I do think that we're doing quite well. Our partners are stepped up to the plate. I think people are accepting the vaccine in a very positive way. And I think as people see that this is as we've talked about lots of times, Randy, another layer to protect us, it is very positive. I do want to say, at this point, and probably say it multiple times in this interview, is that we still have to use masks. We still have to cover our nose and mouth. We still have to have physical distancing. The schools have done an excellent job. You all, Rob and your team and Dr. Crespo have all done an excellent job of making our communities safer. Now, as we vaccinate, we still don't have a vaccine for children. And so I think we're still going to have to wear masks for a while. And in that sense, we will decrease the viral load in our community. And I think that's tremendous.
And so I do want to have you kind of talk about, and I know that this is not new territory. I think we've talked about this numerous times, but the idea that, it does take a little bit of time once you get that second shot to reach a full inoculation. Kind of tell us a little bit about how that works.
Sure. This is a very common question. Stephanie and I just talked about this recently, about what you can do safely after you've gotten your second vaccine. And the current guidelines at the CDC level is that if you've been 2 weeks after your second dose of the Moderna and Pfizer vaccines, same thing is going to be true of the Johnson & Johnson, 2 weeks after you get that vaccine, then you are essentially protected against moderate to severe disease, hospitalization, and likely death. It's still possible that you can get a minor asymptomatic infection, although as we learn more and more data around the vaccines do prevent you from asymptomatic infection, not 100%. No vaccine is 100%, and that's why we still need to use those prevention strategies. I think we'll learn more. It's only been a year since we've been in this COVID-19 pandemic, and I think we're learning things daily. The guidance is likely to change. That's one certainty. We know change, and the guidance is coming. And so I think we just need to be cautious at this point. I'm not a doomer and gloomer. I'm a very positive and upbeat people. People can take control of their lives and try to protect themselves. What happened in Boulder over the weekend is just, to me, unimaginable that young people were engaged in a party without masks. It's just that we have to be still careful. We're not at this point completely free of COVID-19. We need to reduce our risks, and we can talk more about that as we go along.
Yeah, I wasn't quite sure if you would bring it up or not, but if you don't mind me asking, this situation that happened up on the Hill, in which a large party got a little bit out of hand there, and they had to bring the police in. Again, the pictures are remarkable in terms of the fact, it really feels. I know Jeff Zayak oftentimes will say, that there is just this real feeling right now of people being done with restrictions. And I couldn't help but think of that, essentially just a whole bunch of young people that are like, we're just throwing this whole thing off. We're going to have a good time. But again, it got very out of hand. What do we expect? And again, we've got educators that are thinking about, expansion of our in-person learning in a couple weeks, 3 weeks, I think. What could this possibly mean for us? And again, we'll be monitoring the situation, right?
Absolutely. I think it's too early to say. I'm not a prognosticator. I do think that anytime you have large gatherings with people that are potentially inebriated and are not using masking and physical distancing, then there's a greater likelihood of spread of the disease if the disease is there. So that's the challenge with young people, is that 50% of them are asymptomatic. So we don't know. So I can't tell you whether or not they will have a significant impact, but we're all very concerned about it, and we're going to be monitoring this situation very carefully. The other piece of this is the impact of the virus variants. Now we have B117, which is a UK variant, and now in Colorado we have the B1351, which is a South African variant discovered in Colorado. It's likely there. We're testing, and as we've talked about in previous shows, wake-ups, we don't know the impact of those. Obviously, the vaccines are less effective against those variants. Not zero protection, but some less effectiveness. I know all the pharmaceutical companies are looking at potentially a booster to protect us against the variants. But again, the message is we still need to wear masks, physical distancing, do all those things of prevention while we continue to vaccinate people. So I don't want to say yet. We're going to be watching it very carefully. And again, another reason why people need to continue to protect themselves for spread of this disease, because that's not the ideal situation. In fact, it's likely that we'll see an increase in spread of this infection after this event this weekend.
I know that we've talked about this again at the board meeting just recently too, but over the weekend we did get some more questions on social media about spring break. Obviously, again, a very similar sort of idea here that this is no time to just totally throw off all inhibitions and head off and take off the mask and do all those kind of things. And the same thing's true of traveling during that spring break. Is if we want to continue forward in the way that we're going and the way that we've seen these cases decrease, et cetera, that's one thing that we need to be super careful about, right?
Absolutely. And I know SOTA and our EPI team worked on some travel guidance and sent it to you guys. Clearly, the message is very simple, though. Obviously, we encourage people not to travel. If they have to or they need to travel, then using those same prevention strategies are useful. And in fact, particularly, I'm concerned about airplanes and air terminals. If you're concerned about and you're at risk and you haven't been vaccinated, wearing a surgical mask and a cloth mask on top of that is probably a good idea. I would also encourage people to use physical distancing, avoid large social gatherings, just travel with a couple people. And if you're outdoors, obviously, that's a good thing. You have to have some sort of recreation and protection. Recreation, when I ride my bike or we're out walking, my wife and I both wear masks, even though we've been vaccinated. So, I do think that the message is clear. Try to reduce risk, particularly among the most vulnerable populations. The guidance really hasn't changed very much, and I think we can do that while we wait for more people getting vaccinated.
I always love our conversations in regards to the layers, and it reminds me of that analogy that people have used in regards to the layers of Swiss cheese. And regardless of the situation, obviously in more at-risk situations, you want to make sure that you're really layering up even thicker those protections, because again, no one protection is perfect, right? And so, as we kind of transition into this conversation of expanded learning, one of the reasons why I say I love this conversation is that early on, I think it struck me that you were like, these are the same things, that we talk about when it comes to cold and flu season. It's not revolutionary. I mean, the vaccine is pretty amazing modern science, but when we talk about covering your cough and washing your hands and keeping distance, I mean, if people did that on a normal basis during cold and flu season, we would be in super great shape for there. We've got definitely a different kind of virus here that hadn't been seen before. But again, as we look at the classroom, it's the same age-old techniques, and essentially the more layers of the protection, the better that we are. But we are always looking at that situation and trying to add to that and encourage people to participate. And I do want to give a shout out to our staff. Our employees have done such an amazing job. You mentioned the administration of us getting out the message, but really it's the people in the schools that are doing this on a daily basis, wearing those shields, wearing those masks, making sure the kids are integrating into their normal situation. But anything else that you want to add on to that, Dr.
Again, I'd like to applaud the schools for doing such a tremendous job at helping our schools be safer. And now that the teachers, staff, administration is now becoming vaccinated, I think it's even safer. So I think I'm still concerned about the extracurricular activities. I ride my bike around, I watch these large soccer events, I watch these other events out there, and I think people need to take precautions in those communities as well. Just because you're not in school, you should still be wearing a mask, still be physical distancing, washing your hands, all those things. And it's not surprising, Randy, and there's no stronger data to support the fact that when these prevention strategies went into place, we significantly reduced the amount of hospitalizations related to influenza. And at the same time, we got a lot of people vaccinated because they were concerned. We were warning folks about that. Boy, vaccinations, washing your hands, masking, all work to decrease the amount of hospitalizations related to influenza. Hopefully, many of these habits will continue as we create what that new normal is going to be. So I do think we can stop the spread of infections very simply. My mother always told me to wash my hands. So most of the time listen to her. However, now I always quote my mother in most of these talks because it is simple. Washing your hands, coughing into your sleeve, of avoiding distancing when you're coughing or sneezing are all protections against the future respiratory problems that we're going to come to. And again, I applaud all of you for doing such tremendous work. And we're partners together. I do think that's what I want to emphasize. I think we're going to continue to work together. It's great to see BCH as another partner. I think we can lick this with those layers of protection that we often talk about, Randy.
Thank you, Dr. Urbina. And I do want to mention that partnership, it was us together that were looking at these situations. Again, up to this point, we've had, cases that were going down. Obviously, all teachers and employees having the opportunity to get vaccinated was a huge addition to that layer of Swiss cheese. And so that's what, sort of prompted us to decide to go ahead and ease the secondary level. But again, we'll continue to watch the situation, especially with all the things that have happened this weekend. Stephanie, I did want to come back to, Dr. Urbina was great about sort of talking a little bit about some of the things like the vaccinations. And, this again is not a carte blanche, you can do anything kind of deal, but we are seeing that it can impact quarantines. Do you want to talk about sort of the protocols a little bit?
Sure. Thanks, Randy. I appreciate that because there can be a lot of confusion. COVID has been confusing all along. Like Dr. Urbina said, our guidance changes constantly. And sometimes we understand why a little bit better than others. But especially around the vaccines now that folks are getting and coming a lot of staff into their second dose, I want to just make sure that everybody is really clear and understands kind of what that means if you get sick, what that means if you have been in a classroom or been exposed to somebody, and also around kind of ending quarantine. So the first thing that I want to just mention is even after you've been vaccinated 1 dose or 2 doses, if you develop any kind of COVID-like symptoms, similar to what we've been doing all year long. Major symptoms such as a cough or a fever, shortness of breath, or minor symptom, sore throat, headaches, congestion, nausea, vomiting, anything like that. We still follow the same return to work protocol. So a major symptom has to resolve within 24 hours. A minor symptom has to resolve within 48 hours. And if not, then we need you to go to one of our amazing testing sites and get tested before you can come back to work. So that has not changed at all with the vaccine, and we want folks to understand that. The second thing is really around exemptions from quarantine. Right now, we have two ways that can happen. The first is if you are 14 days or more past your second vaccine, you are exempted from a quarantine in most situations, not necessarily all situations, but in most situations. And we would review that with you and with the school team if there was an exposure. The other way would be if you have tested positive for COVID using a PCR test within 90 days. Has to be within 90 days, can't be more than that. And then you are exempted for 3 months. All right. And those are really the only exceptions right now. Again, like Dr. Bina mentioned, we know the guidance will change. We'll update everybody as soon as we can when that happens. But right now, those are the only exemptions. And then the third thing I wanted to mention is really the ending quarantine. There's been a lot of changes, a lot of discussion around when quarantine ends. Here in BVSD, we're continuing to utilize a 10-day quarantine period. So if you've been exposed, thanks, Dr. Bina, and you do not have symptoms within the first 10 days of that exposure, you can come back to school or to work and continue to monitor for any symptoms for the full 14 days. And I think that's really important. We have seen a few cases where folks have actually gotten sick on day 12 or 11. And so we really want to make sure that folks are continuing that monitoring for the full 14 days. And the one thing I want to mention, and I know Dr. Bina might want to jump in on this, is why we're doing 10 days and not 7 days. In terms of additional risk, if we quarantine at day 10 without any symptoms, the risk of transmission is really about 1 in 70. If we quarantine on day 7, with a negative test around day 5 or later, that risk actually jumps up to 1 in 19. So we really want to encourage our families to follow that quarantine rule. And right now, that's whether it's in athletics or in school, we're following 10 days. There is an exception to that, and that would be, as Dr. Bina mentioned, if we detect a variant case, then that quarantine will be extended for anyone for a full 14 days. And that, is likely going to happen in the future. Like Dr. Bina mentioned, we have variant cases here in Colorado, and we have some in our community. And so oftentimes we don't find out about the variant right away. We might be somewhere into that 10-day quarantine and then need to extend it. And we'll let families know and staff know as soon as we know. So those were really the 3 things I wanted to mention and make sure that folks understand, and we'll get that in writing out to everybody so it's nice and clear also.
I did want to also just, and thank you for sharing that. I think that it's so important. And I think one of the things that you said really reminded me of something that former Director of Communications, Chana Gusetis from the Boulder County Public Health Department had mentioned, which was, none of these things are an absolute rule or, that they're all kind of levels of risk. When you talk about trying to keep a 6-foot distance, that is because, again, of, the studies have shown how far the virus can travel. And when you get closer, there's more risk. And when you go farther, there's less risk. But it doesn't mean that you couldn't be 20 feet away and still possibly have risk of having that, transferring that disease. Or you could be within a foot of someone and not get it. And so I think that that's sort of, oftentimes, people will look at all these things and sort of say, Yeah. And in fact, let me go to one of the questions that we got, if that's okay, Dr. Urbina and Stephanie, in regards to, they sort of two middle school teachers kind of wrote to us and said, please discuss physical distancing guidelines a little bit more. One specifically kind of went into the idea that, the 3-foot exception, when the CDC was recommending 6 feet, which I know that we've talked about this before, but right when we started talking about expanding secondary, that's when the CDC came out with their guidelines and said, 6 feet is really suggested. And I think that, again, absolutely, the more opportunity that you can have to social distance is great. But again, we are making a balance here in order to get more kids in school, in order to have the benefit of them being in person. But Chris, is there anything else that you'd want to add in regards to that, in terms of, again, we are looking at the situation and saying, yes, 6 feet is great, it's the gold standard, but 3 feet with the mask is actually, quite good in a school, especially with all the other measures that we have.
Great. I just want to give a shout out to Stephanie. Boy, you did a great job of explaining our quarantine and 7 days, 10 days. Thank you. Kudos to you. I think that's tremendously how you stated that. I like that. 1 out of 70 and 1 out of a 19. So great question. There have been multiple studies. The one that's quoted most is the meta-analysis that was done back east that looked at 39 studies and grades of protection. Obviously, the farther away you are, the greater, less risk that you have of contacting the respiratory droplets, as well as aerosolization of the virus. But as you go closer to 3 feet, the risk increases. Although 3 feet is really that minimum that we'd like to see. 6 feet is better. 3 feet the minimum. But again, as we've talked about at previous shows, the stuff that Rob has done in terms of increasing filtration in the schools, of cohorting kids, of washing and disinfecting surfaces and wearing masks and goggles and shields also decrease the risk of getting spread of the infection. So those are layers that we've talked about in the past. The Swiss cheese example really applies to this. So I think there's no perfect gold standard, but there is degrees of risk. 3 feet being the minimum, 6 feet is better, 12 feet is even better, but then you lose some of the socialization that kids and teachers need to actually have effective schools. So I think we're providing guidance, although nothing perfect. I do think that the CDC was being a little conservative regarding 6 feet, but again, I think they know that people, in all practicality, 6 feet for everybody is impractical throughout all the schools. So we're really recommending 3 feet as that minimum, and the studies and the science support that.
We just got an additional question to that, which is just the idea of, the length of time, as well. Is that a consideration that people should be thinking about as well? I mean, in regards to how long the teacher is into that same space.
Sure. Stephanie, do you want to tackle that one in terms of how our quarantine and guidance goes in terms of exposure in the classroom?
So that has also changed a little bit. Back in January, I believe, we had, and there continues to be 2 different ways of kind of contact identification of folks when we're talking about quarantine. Is that the question that you're asking, Randy?
Yeah, I think they were sort of expanding upon the thought of, okay, so 3 feet and 6 feet. Okay, we get the idea of distance, but then they also add sort of the third dimension in there in regards to time and how long a teacher is going to be in a classroom with the students as well.
So right now, the guidance is if you're wearing a KN95 mask and a shield, there is no time limit as far as how long you can be in a classroom with students. And we know that at our elementary level, oftentimes teachers are with students for most of the day in their grade level. We also have found that if teachers are wearing a cloth mask and they are absolutely confident that they have not worked within 6 feet of students during the day, we have not seen transmission that way. And so if the student is masked and the staff person is masked, even with a cloth mask, and they are very confident about that distancing. We have allowed them also not to have to quarantine. And again, we've not seen any transmission that way.
Perfect. Thank you for answering that. I do want to also kind of expand into a couple of the questions that we had here in regards to, we know, and I think you just mentioned our elementary students have been doing this since the beginning of January. If you're ever in a kindergarten class, kindergartners will follow a lot of directions, but one of the things that they're not really great at is keeping social distance. And so these little ones are in each other's business, they're in the teacher's business. That kind of thing. And so the question, as we go to secondary is really, as we walk around campus, one of the concerns is about, the lunch period. I don't know if that's Rob or Margaret that can kind of talk about what that will look like in the cafeterias when their masks are off. Obviously, I know that we're encouraging them to consider also offering opportunities outdoors. But will there be social distancing? And the other question I want to get to from this as well as I kind of dig into some of the questions is really the idea of, they're rightfully saying that, kids in the hallway don't necessarily distance. And, that could be a time in which I imagine that some of the cohorts might be mixing. But I know that there have been thoughts in regards to the way that the setup was to not have all students mixing throughout the day. That was part of the reason why we went to the structure that we did. So I don't know if Rob or Margaret want to jump off in one of those two questions. Sorry about kind of double loading that.
Randy, I'll tackle the cafeterias. If you look at what our elementary schools have done over the past 6 months or so, that's exactly what we're trying to achieve. So they're staggering their students at the lunch tables, so they're able to maintain as much distance as possible, but still feed our kids and get them through the lunchroom. So, cafeterias are no different than classrooms. We still have our air purifiers in the cafeterias. We are still doing air exchanges. We're still cleaning. So those layers are all in place. And we understand that they have their masks off while they're eating. But the idea that we're staggering them is what we're attempting to achieve. So they're not sitting right across from one another while they're eating. Again, we would encourage, now that the weather's getting a little bit nicer, go outside, let's eat. So if we can rotate those cohorts through the cafeteria and have one cohort eat outside one day and then inside the next day, we would continue to encourage that. So.
Perfect. And Margaret, do you want to talk about kind of the structure of these classes in the hallways? And, again, I know that nothing's perfect, and we don't want to run a military organization here in which we're, having the kids march through the hallways. I think that's something that's been shunned upon by parents, et cetera. But, we are trying to embed into kids, sort of thoughts in regards to safety. But what can we talk about in regards to what schools are doing to prepare?
Sure. I would definitely say that we learned quite a bit having our elementaries come in, our arrows on the ground, our staggered opportunities. In some cases, their cohorts may be mixing, but what we have realized is that the numbers, there are other mitigating factors, like kids are staying 6 foot apart as much as possible, 3 feet, masking, trying to take breaks so that they're away from each other. So, very similar to the Swiss cheese example, we're trying to make sure that there are a number of mitigations that are happening at the same time, so that if distance is an issue for a little while, or if they're walking in the hallway, that it's just one of the factors. And we have had a number of our, I want to kudos to operations, our food services and our custodial staff have really done a great job of meeting with principals and staff to figure out what are the best ways to work through those spaces and what that looks like. The other piece that's really helpful for us is the seating charts. Knowing where students are sitting in their classrooms at all times is really helpful, because then we're able to contact those individuals that are possibly exposed, versus trying to send a whole group of students home. That's really the most important for staff, is to have those seating charts available and updated as much as possible. We do know that the high school specifically are working on their lunch periods and what that looks like, so that students don't have a lot of congregation time. But the reality is that it's one of many factors, not a single factor.
And again, Stephanie, the idea that as you've got these kids, like when they're in a classroom where they're sitting for a long period of time, I don't know if you've ever seen one of those animations where they're kind of showing a sick person and the dots are kind of emanating from them. And, obviously the people that are in that radius are the ones that are the closest to those dots that are then coming out. I don't know if that's a good analogy or not, but in a hallway in which you've got, more space, hypothetically, but then also kids are just sort of, maybe a touch and then they're off on, on the way. The idea would be less time for those, to use a Kyle Clarkism from 9 News, swapping the droplets. They're hopefully not swapping as many droplets. And obviously in high school, there's all kinds of other things that could happen there in the hallways. But anyway.
Well, the other thing, I wanted to mention exactly that. In the hallway, it's pretty quick. Folks are moving, so they're not necessarily standing. And of course, they're going to be standing and talking for a little bit, but it's not a 20-minute passing period, right? So folks are getting to their next class. The other thing that's really helpful for us at secondary is that we can actually interview the student and ask them, who did you sit with at lunch? Who is your buddy that you walk to class with, or that you go from class to class with, so that maybe they don't sit next to that student, but maybe it's the person that they connect with every time they go to their next class. And we can do that. So that helps us also, where, obviously that sort of interviewing is not necessarily as helpful at the elementary level, but once you get into middle and high school, a lot of times kids can recall that they've got their friends that they meet with all the time, or they ride to school with, or walk to school with. So that really helps us as well at the secondary level.
Perfect. Hopefully, I can't imagine that there's as much kissing going on in the hallways with masks on, but maybe we shouldn't have gone into that at all. Anyway, I do want to just again, and I understand that a lot of our staff members really want specifics, and so we had one of the teachers that reached out before from Louisville Middle School asked specifically about the guidelines that we're putting into place at secondary for classroom distancing. Again, I think the idea is that in a lot of cases here, we're really waiving the distancing. If we can keep it at 3 feet, then that's the idea. If it can be 6 feet, even better. As much distance as Rob or Margaret. Again, what are we asking actual principals to do in the classrooms there?
Randy, we're asking them to provide as much distancing as physically possible. So spread out as much as you can, but as we all know, a lot of our classrooms are limited. We've been encouraging people to think outside the box a little bit, and what other spaces in the building can they use? Can they use the gym? Can they use the cafeteria or library for instructional space? So, but we feel comfortable with the layers that we have in place. So yeah, I mean, we're going to physical distance as much as possible, but it's not going to be perfect in every scenario.
And again, I think it's okay to be somewhat upfront here to say that there are going to be situations in which kids are in a closed classroom situation that there isn't maybe even 3 feet. Much like, again, I was talking about with kindergarten, that they are in a cohort and they are closer than that. And so, looking only at bringing out your tape measure and measuring the seats is not exactly the way that we're approaching this. That essentially with the vaccinations, again, the caseload coming down, hopefully, again, that continues. These are things that we're easing at this point for those reasons. So I just want to be upfront with folks. Mike, you've gotten an opportunity to I'm sure that you weren't even thinking that I was going to ask you a question, but I'm going to anyhow. I know that, again, we talked about all the vaccinations and the things that have been going on over the weekends. With that second shot, there is a bit of a risk. And actually, I might have Dr. Urbina kind of talk about what people have seen first, and then have you kind of talk about the HR side of this. But it's quite possible that somebody can have some symptoms following it, and even some, I wouldn't say severe, but there are definitely some situations in which you're not going to feel well. You may not be able to work. Stephanie kind of talked about some monitoring there. What have people been seeing out there as they're getting that second dose on the more acute side of things?
Are you asking me or Mike?
For you, Chris, and then I'll talk about the leave aspect of things with Mike.
Great. I think as you've all experienced, and many of you have gotten vaccinated, expect side effects. I think if you have a sore arm, a little swelling, you don't feel very well, a little fatigue, maybe some achiness, and in some cases fever, expect those. And I think some people have had a little stronger reactions after their second dose. But most of those symptoms, actually all of those symptoms, go away within at least 36 to 48 hours. And so expect that you're going to feel a little bit punk for a few days. And what that means is that your immune system is revving up. You have a foreign substance, the spike protein with the Moderna and Pfizer vaccines. So your body's gearing up a response to that. You have fluid go to the area. You have all your immune systems, T lymphocytes, B lymphocytes, all acting as if you had an infection. And that's a good thing because that's protecting you. So if you don't have those, well, it doesn't mean you didn't get the vaccine. It just means that your system is different than everybody else's. So, but if they persist beyond 48 hours, then I think at this point, then you need to consult your primary care provider and talk to your HR, talk to your supervisor to make sure that they know that you may have had more significant side effects. Part of the reason why we watch people for 15 minutes afterwards and we ask you questions about what your exposure has been is to try to identify people who might have a severe reaction, and so that we can take those into account. So all of those things are safeguards, but obviously we want to know if you have significant impact, and we want you to tell your school folks that this is what you're concerned, so we can report those if you do have more severe complications other than the ones that I've talked about. So, Mike, I'll leave it up to you to decide how you want to handle some of those concerns.
Yeah, so I guess the question would be, Mike, we know that it's possible that somebody might have a high fever or, some of the symptoms that Chris mentioned. What should they do? They should not be coming to work if they're definitely having these kind of symptoms, right?
No, definitely not. And Dr. Urbina is correct in terms of the symptoms. I had my second, and yesterday I was fatigued. So I know what that feels like. But I think to that degree, that's why the Boulder Community Health, we decided on Saturday, because Saturday would give us a day and a Monday, as we do asynchronous learning, to enough time for people to get back to recovery as to their normal selves. So, but if there's something there that goes wrong and the symptoms last more than 48 hours, they can use, we do now know that as the government has stepped in and given us some additional services called FEL, Public Health Emergency Leave, which is COVID-19 leave basically. But it's as of January 1, 2021, we went through everybody's leave surpluses and then found that if you had less than 80 hours of that leave, you could tap into COVID leave. If you already have that leave, then you tap into your annual or your sick leave at this time. So the good news is the vast majority of our employees have enough leave if something like this were to occur. So it's something they can do, and we encourage them that if they're not feeling well with that, they need to stay home.
Perfect. Stephanie, did you have something you wanted to add?
Yeah, I really want to stress what Mike just said. We are getting a lot of reports of people saying, "Oh, it's just my second vaccine. That's why I feel so badly." We can't be sure of that, and you might. There's always a chance that you had been exposed right before that second vaccine, and now your symptoms are COVID and not just the vaccine. So please don't assume that it's always just the vaccine. It's more than likely that's what it is. But again, don't come to work if you're experiencing any of those symptoms. Stay home, let it resolve, and then come back to work. The other thing, if I can mention,
we would much rather people take the precaution, right?
Yes, please, right. More and more folks are getting notified through the app that CDPHE has out about exposures also, and so we've been getting a lot of questions about that. And right now, again, if you have the notification app on your phone and you're notified that you've been exposed, you need to take that as a true exposure. And so we're asking folks to stay home and quarantine for 10 days. It tells you when your exposure date was. Unless you lost your phone, it couldn't possibly have been with you or something like that. We're treating that just the same as any other kind of an exposure. So I want folks to hear that as well. Thank you.
Perfect. Rob Price, I do want to ask you a couple questions in regards to ventilation. We did have a teacher that's kind of talking about, very small room, obviously expanding, number of kids. They don't have the ability to open windows. Again, that is why we've looked at our ventilation systems and are really trying to do the best that we can with the systems that we've got, higher filters, that kind of thing. Obviously, the air purifiers. What would you want people to know? And my second question to that, Rob, would be also that if they've got a specific question, because I'm sure that specific rooms in this district might have certain challenges, right? Is there a good person for them to reach out to as well?
Yeah, I'll address that second part, Randy. If anybody ever has any concerns regarding ventilation, they can always enter a work order through our ServiceNow system, and we'll get a team out there to make sure that we are getting the number of air exchanges that we've ensured. So really, interior classrooms are no different. I mean, we're still getting the proper number of air exchanges. We're monitoring that through CO2 sensors, et cetera. We have the air purifiers in those classrooms. One thing, again, as we're thinking about it getting nicer outside, utilizing the outdoors when we can, utilizing other spaces, depending on how many kids we're putting into those classrooms. So, but those spaces from a ventilation standpoint are no different than anywhere else. Now, the exterior classrooms, if they have operable windows, which some of our buildings have and a lot of our buildings don't, you can open those windows to achieve more air exchanges. But really, just from a pure data standpoint, we're achieving the same number of air exchanges in those spaces that we are on an exterior classroom that has a window, for example, that is not open. So,
and I was going to say that I usually assume that people kind of know the history of indoor air quality and BVSD, but this has been something that the district has been working on for many, many years. We actually have some experts, one at the University of Tulsa, one at CU Boulder, that work with us and give us direct feedback. And so we're not just out there in the blind trying to do this. We're really following the feedback of some experts as well, right?
Great. Yes, Randy, we're working with Dr. Richard Shaughnessy and Mark Hernandez at the university. And right now, we've got a number of CO2 sensors deployed through the district. I'll give you an example. Last week, we had a couple classrooms where CO2 reached about 1,100 parts per million. We're trying to keep it below 1,000 parts per million. So Mark initially contacted us. This was about a 15-minute interval. Our team reacted immediately, made adjustments, and brought that back down. So we're still right in the middle of this indoor air quality study. We've done about 2/3 of our buildings, and now we're on that last third, just assessing the data, et cetera. So, but we're one of very few districts in the entire nation doing something like that to that extent. We're looking at absenteeism. How does indoor air quality impact absenteeism? What we've seen over the last couple of years is we've reduced it. We've done the same thing with the desktop cleaning study. If we clean our desktops, does that reduce absenteeism? So very few districts do something like this, and I would credit a lot of this to Dr. Anderson, to our Board of Education, right, for pushing this initiative, knowing the importance of it. So thanks for bringing that up.
And while I've got your mic, I'll ask you the question about, I know that your team is working on expanding testing. So obviously that will be an extra layer of support. But we'd also expect that, in case anybody's watching the dashboard, that when that starts to happen in a couple of weeks here, that we would expect that we would also have higher numbers of quarantine, because we're going to be randomly screening folks throughout the whole district that might have been asymptomatic, which is good because we're catching folks, but on the backside, it may look like a spike in cases as well within the district.
Yeah, a couple of weeks ago, Randy, we put out a survey. Your team actually put out a survey and asked for teacher input. And, looking through that survey and really trying to pick out what additional layers can we put in place, the number one thing was increased testing, COVID testing. So right now, as you know, we have 3 mobile testing sites. One site really serves Nederland, and then the other 2 go through the district. And then we have our large Centaura site, thanks to COVID Colorado. So what we're going to be starting on March 30th is testing sites at every school every single week to really do a random testing of about 10% of our students. So as you talk about, we will expect the numbers to go up, but this is more of a screening testing. So we're going to need significantly more of our students to opt in to the program. So right now, we only have about 7% of our students that have opted in. We're really going to need more than 40 or 50%. And, you know, I want to say thanks to our health services team and our safety and security team that really led this work. But we're increasing our nursing staff, we're increasing our testing capacity significantly to meet this need. And this is the number one thing that came out of the survey results for me is what else can we be doing? And this is what we'll be doing across the board, all the way from Mapleton at the ECE, all the way through our high schools.
Perfect. Thank you for that. Margaret, I do want to ask you this question that came in regards to, you know, and I know that we've been trying to find the right balance between allowing families some flexibility. You know, when the announcement came out that we were moving to 4 days, then, you know, we kind of said, well, if you want to stay hybrid, let us know. If you want to move, let us know. There, a lot of those things were the idea that a school could still have sort of purview depending on their needs and what's going on in a classroom, et cetera. But they were sort of asking, you know, why couldn't we just tell them that, you know, that they can't have that flexibility and they can't move between it because the wishy-washiness is very difficult. Obviously, I think we certainly feel that. You know, it's part of the reason why next year we're going to BU Link for the remote learning aspect of things. But what would you want our teachers to know in regards to that?
So I would say that we certainly are pushing for the commitment from families to please pick, you know, stay where they are or connect with their schools. We understand that in some cases our buildings are able to manage having the students switch or change or because of the way their staffing is set up. And in some buildings that's just not possible. So we're very aware of that and certainly letting families know that it's not desirable. It's not something that we would that we appreciate because it really makes it much more difficult, and that there have to be specific circumstances as to why that would happen. Similar as if we were in 5 days a week and there was something happening and we were working with families for whatever the topic is. But we also recognize that some of our buildings have to have that level of flexibility based on their staffing. So just understanding what that looks like and working with the buildings and those buildings that haven't been able to do it certainly have reached out so that we can be very clear when we're speaking to those families about the inability to have that level of flexibility.
And of course, the difficulty part about this is when a family, you know, has circumstances where they don't feel comfortable expanding out. The remote side of things tends to be sort of the default. Like we want to be able to give families out, but the ability to expand, have more people come in the classroom has been more limited. But I do want to, you know, just sort of hit on that kind of point again of like, we understand the frustration here where, you know, you know, being able to a la carte, you know, oh, I only want to come, you know, 2 days a week, or, hey, I'd like to come 3 days because, you know, my kids, 75% feeling okay with coming like that. It really does put our employees in a bind and our teachers in a bind when they're trying to meet the needs of a whole bunch of different kids, having all these different variations, right?
Absolutely. And that's one of the reasons that we strongly want families to connect with the school. We don't want that level of flexibility to happen unless they're extreme situations, because we don't want to burden our teachers anymore. We understand that, you know, for everybody, the year has been really difficult, and that kind of transition just puts more pressure. And one of the reasons why we've tried to keep away from allowing that. So definitely something that we're supportive of and driving home when we talk to families about what their choices are and what's available, and asking them to stay within what we're doing, and then working with the principals.
And well, I've got you one more question, which is just the idea of, we were talking about schedules and that kind of thing. Part of the reason why we went to the schedule that we did in the quarter and all that kind of thing was to limit. In a normal high school, that, you know, 8-period day has a lot of transfer between people throughout that day. That was part of the reason for what we're in now, correct? To limit that?
Yes, we were as much as possible trying to plan ahead for that return and what might look like. And the reality is that it frankly has become another mitigation strategy, because our students are not crossing over very often. They're not moving around 16 times a day. We've been able to limit that. So that becomes just another layer of mitigation strategy. And although difficult, I mean, we certainly recognize that it's a change, and with all changes, there are habits that have to be reassessed and redone. But the reality is that it has helped us and will continue to help us come back as safe as we possibly can.
Thank you, Margaret. I'm going to pose this one to Mike Grados. What are we doing about sub-teachers to cover absences? Have they been offered vaccination, and is that pool strong currently?
Yes, we have had substitutes who have been with us since the pandemic started that we have vaccinated and will continue to do so. So we'll still do the best we can to cover. And of course, along with the classroom monitors, that's been a big help. As a matter of fact, I've known that we've got even some classroom monitors who have been vaccinated as well. So we'll continue to do that, and we'll continue to cover as much as we can with this. However, we do have a 90% fill rate right now. And that's because people are either online and can teach from home, but also people aren't using leave. They actually are committed to making sure that kids are getting served. So that's great. So I really thank the teachers for that.
Thank you, Mike. This is my last question I have, and then I'm going to go around to anything that people want to make sure that they say before the end of it. But Stephanie, it sounds like there was a conversation at TAC a few weeks ago, a few weeks ago, in regards to bandanas and whether or not they're okay, in terms of face coverings. And it sounds like the guidance is no, that because they don't fully close. Are we going to be taking a more firm stance? Obviously, that's I can certainly help to kind of communicate that out to the community if that's so. But what's sort of the latest on that?
Our face policy, our face covering policy is online, and if I recall correctly, we've written a lot of guidelines lately, but that says it has to fit tightly over your nose and your mouth. So although we have allowed gaiters because they do cover, and Dr. Urbina has, I think, always stressed that, something that somebody wears and is comfortable wearing is going to be more effective than something that they're uncomfortable in, that they're kind of fiddling with a lot and things like that. However, bandanas do not, like you said, cover tightly around the nose and the mouth and the chin. And so we have, I'm pretty sure that our guideline does state that bandanas are not allowed.
Okay. Thanks for covering that. Chris, anything that you want to add? I know the multiple fly, obviously KN95s are more filtering, so that's always better. Anything else?
No, I think Stephanie said it well.
Okay, perfect. Again, I do want to go around the horn one time and just give everybody an opportunity. If there's anything more that we didn't cover that you want to say, Stephanie, since I had you on, anything more?
I don't think so. I'd like to thank everybody again for all of the work that they're doing with the seating charts, with masking, with distancing. Although we do have quarantines, we're not seeing folks getting sick in those quarantines from our classrooms. And, that's the thing that we really want to stress. We're going to have quarantines, but we really don't want folks to get sick. And we're not seeing that. So it's working. We're doing a really good job.
Perfect. Thank you, Stephanie. Rob Price.
Randy, a lot of these are really focused on what happens inside the school. I just want to take the opportunity to thank everyone that's doing the work, including, our custodians, our bus drivers, our maintenance staff, security, everyone else. If you're watching, thank you very much. I know we've increased the workload significantly, and you've stuck with us. So thank you very much.
Well, that's about the understanding of the year in regards to this has just been a year of a lot more expectation, and we thank everybody for that. Mike Rados.
I'll echo what Rob said, just thanking everybody. But I also want to make sure to say that even though the year has been as tough as it's been, it's created some new opportunities for us as well. Moving forward, we're going to have a much more efficient system that I think will look really well as we move forward. So thank everybody.
Thank you, Mike. Margaret Crespo.
Thanks, Randy. I would just say I would echo what everybody has shared, and then think about the fact that a year ago we were here thinking about what was going to happen and what it looked like, and the level of community support and the partnerships that we've built, not only with our internal employees and our community partners and families, really could not be duplicated. And just so grateful to be part of this process and the amazing work that we do to keep our kids in school and connected as much as possible. And we can't do that without each other. So just want to shout out to everybody the same.
Thank you, Margaret. Dr. Urbina.
Thank you for always having me for these wake ups. I get up early, so this is good for me. And I just want to say thank you to all of you and our communities for stepping up to the plate. We can reduce our risk out there, and we've talked about it many times. I would encourage people to get vaccines as when their time is up to get their vaccine. We can make a difference and reduce our risks in our communities and in our schools.
And I want to thank all of you. Thank you all to all of our panelists for joining us today. Thank you for your time. I know that you're all very, very busy. I also just want to thank all of you out there. Just like everyone said, it's been amazing to watch this. It's hard to believe that it's been a year since this pandemic began here in Colorado, and it's been truly amazing and heartwarming to see the work of our staff and our employees, our teachers in the classroom as this has happened. You guys have been amazingly flexible, amazingly, I believe, heroic in the work that you guys have been doing. I am humbled by watching all of what you guys do on a normal basis. I thank you for waking up with us this morning, and I hope that you have a great week. Thanks.